This is Dr. Andalak from theGentlDentist.com in Shelby Township, Michigan. Phone number is 586-247-3500. And a topic I'm going to bring up today is called, well, it's to extract a tooth or not to extract, and that is the question. Anytime we have a patient who comes into our office in pain, and if it's developed if it's pain from within the tooth itself, we have a decision to make, and we try to help walk that patient through the process of whether to save a tooth or not to save a tooth. Sometimes it's possible to save a tooth as long as there's enough of the natural tooth above the gum line that it can be built and it'll be structurally strong enough to save, and then to do what's called a root canal. And then from the root canal we can actually do a crown to cap the tooth to make it strong again. Those are pretty simple processes between whether to save it or not. What becomes a little bit more in the gray zone is if the cavity is so large that it goes below the gum line, and sometimes there's not enough of that tooth structurally to build anything on that the person can use to bite and chew with. So that usually we'll walk through a set of x-rays and show our patients and make a decision that's best for them. Usually financially, short-term financially, extraction is going to be a less of an investment. All right, it gets you out of pain. It is a valid source of removing the infection out of the tooth, but that's short-term. Long-term, if we can save a tooth, it's much better because that tooth is there for a function. That is to preserve the space that's in there so you can chew your food. It also prevents the other teeth adjacent to it and on top of it from shifting and moving around. That in itself is very important because if you can't chew your food, it's basically a domino effect where things continually get worse and worse. Other times you may extract a tooth is if, for example, if there's a tooth opposing it, that area is missing. It's called a non-functional tooth, and at that point in time we may elect to go ahead and remove that tooth, even though we could save it with something called a root canal. Let me define what a root canal is. A root canal is when you have an infected tooth that where you have a cavity in it, and that cavity gets into the nerve, and that nerve starts to pulsate as the nerve is dying out. That'll even get so bad where you can get an infection in the base of that nerve, of that tooth. And so this creates a lot of pain. To treat that, sometimes we'll put a person on antibiotics, and sometimes we won't need to do that. But we give them adequate anesthesia to numb them up and make sure they feel comfortable. That's always priority number one, is being comfortable here. And then number two, after we get done doing that, we remove the infection in there and replace that nerve with a rubber material that kind of blocks it off and seals off this infection from just seals it off and helps to heal it up. And then we'll have to build that up, and because we have to put a hole in the tooth and fill the cavities there, we have to cap it and it goes around it. So that is going to cost more money initially through that investment. So it is more of an investment, but you'll see long term it'll be much better, long and short term, because if we can save your natural tooth, it is definitely the best thing to do for you. So if there's a question whether you have a toothache or if you had a problem in the past, you may have had some swelling, you're going to have a decision to make whether to remove the tooth or to save it. And we will give you our unbiased opinion. I remove a lot of teeth surgically, or just we call it simple extraction. I also do the root canal, so I really don't have any investment one way or the other. It's whatever's going to work best for you, our patients, and we will definitely do that. And if you have an emergency, you can give us a call. Our phone number is 586-247-3500, or visit our website at www.thegentledentist.com. Thank you.